Doctor, so tell me this, when I take a look at, say, Invisalign,
Yes.
I think, there's a lot of people who are seeing these online, don't see a dentist, just go through us. Tell me your thoughts about that.
I would highly recommend patients to go see a dentist who have knowledge and expertise and years of practice to take care of the patient, to take care of the case, to do Invisalign treatment. Not just go for online. You don't know what their history is, whether they are certified or not. You always should go for your treatment because your health is more important than your money, than you want to do it in the right way in one go.
Yeah, once you don't want to have it redone or
Yes.
have to do it again.
Yes. If we try to do the case which is already messed up, it makes the case more complex. That's why it's always better to take care of your health and choose your doctor wisely. Make sure they have more practice throughout the years.
So, doctor, with these online, offerings where you don't even see a doctor,
Yes.
what are the liabilities of that?
So, all these are a little bit risk taking for your oral health. It's not that simple that you're just focusing on shifting your teeth so that you have a good smile. Just don't focus on that. It's far more beyond that point. When we consider making your teeth and smile kind of aligned properly, we also consider if it's healthy for you or not, if it's making your jaw in a right position or not, is it going to cause any problems in your bite or not. So these are minor factors which doctor going to study throughout the appointments, how your teeth are shifting, if shifting this way is causing any problem in your bite or not. So these things needs to be considered. When you're doing it by yourself at home, you don't know what you guys are doing. So you just, straightening your teeth and all of a sudden your teeth are loose. Then you come to the dentist, it's way out of hand to fix that part.
So then looking at that, a person, say they do that treatment, their teeth are straight, but their jaw or something isn't properly aligned. What could be the knock-on effect of that?
I have seen a couple cases where the patient tried to fix his teeth by doing online, taking his own impression. First of all, impression is very sensitive type. If you don't have digital, these days we do digital impressions, but if you do a manual impression, it has to be with a trained person. If you are doing it by yourself, even a minor error in your impression, your tray not gonna fit, or it gonna show you error, or it not gonna work the way it's supposed to. So it's right there, it's gonna cause problem.
Right from the beginning.
Right from the beginning, and you are not aware of it.
How would you? I mean, you're not a doctor, you're not a trained assistant or whatever.
Yes.
Wow.
So it needs to be taken care of in each and every step by a experienced personal, doctor, dentist, or assistant. If you're doing it yourself, that's more like a DIY, which people do it at home. And in that case, that patient came back after 6 months of his own treatment. His teeth were way loose, especially in the lower front, and I felt so bad for him because we couldn't save those teeth. The lower front teeth, need to came out because the way he shifted his teeth, he lost so much bone around those teeth.
So what then happened, if I can ask about that case, what happened?
Well, then we have to end up doing implants on those case and a lot of bone graft because he lost so much bone off. When we shift our teeth, the bone is to, where we're putting force, the bone kind of resorb and the other side bone has to come around. So it's more like a bone resorption. It's like a game. We have to play around. And we can do with the increments. If we do it all of a sudden, too much force, the bone will not gonna survive and bone gonna fail. If there is no bone, the tooth gonna fail and the tooth gonna come out. So that's what happened with the case. And we end up putting a lot of bone graft, a lot of implant, more, surgical wise, which could have been a very simple case.